Assalamu alaikum, the clinical day. The first scenario, Mr. George Adam, 39 years old, presented with fatigue, muscle pain, and sore throat. Please take history, examine him, and address his all concerns. You can start now.
Hello, my name is Dr. Huda, one of the doctor in the clinic today. I am talking to Mr. George.
Yes, I
Mr.
am.
George, Mr. George, we are here today to discuss some issue related to your health condition. Is that okay with you?
Okay,
Okay, his
doctor.
voice interrupted. Okay, so before I proceed further in my discussion with you, I have a letter from your GP stating that you have been lately feeling tired. Can you tell me more about that?
Yes, doctor, about 3 days now, I feel soreness in my throat and I feel weak all the time.
Okay,
I'm not sure what is going on. Okay.
and before this, you say 2 days, everything was normal, and you complained before.
Yeah. Yes, I was very normal. Nothing is
Right. And this tiredness and muscle pain you say throughout these 2 days, is it increasing or the same?
increasing, doctor.
Okay. Did you notice anything increase this pain and tiredness?
Walking, walking, exertion, anything make me more tired.
Okay. Anything you notice that is maybe get you some relief?
No, nothing relief it.
Okay.
Even
So,
at rest, yes.
okay. Okay. So first I will see about this fatigue and tiredness. Did you notice it's at the beginning of the day or throughout the day?
All the time. All the time, doctor. Night,
Okay.
evening, morning, every time.
Right. And
I
you
have
say that,
I have muscle pain and joint pain
right.
also.
And okay. And you told me where exactly this muscle pain?
All muscles, doctor. All my muscles. In
Okay.
limbs, in trunk, in shoulders, even
Right.
my hands also.
Okay. So this is, can you grade this pain from 1 to 10 and the 10 is the severest?
About from 10, doctor.
Okay, I'm very sorry about that. And with this pain and muscle pain, any other side that you have pain, such as your chest or other than the muscle?
I have also pain in my throat and
Mm.
I have abnormal sensation in my legs and my hands also.
But no, since when you have this abnormal sensation?
All are started, all with each other. And I have headache also, doctor.
Okay, can understand that. And you can explain for me more about this sensation. Is it more of tingling sensation? Is it more a
Yes, it is.
numbing?
Yes, yes, it is tingling sensation, doctor. Yes,
Mm. Okay, so it's in your leg and your hand, right?
both. Yes, doctor. Yes,
Both. All right. Can you just tell me exactly, is it mainly at your hand or sometimes mainly it's in your arm or no difference?
no difference, doctor.
No difference, right? Any pain in your wrist,
In where?
in your wrist area of the hand?
Mm. Yes, doctor. I have generalized pain
Right, all
and
over.
weakness.
Right. Okay, so I will ask you, do you have any medical condition I should be aware of?
No, doctor. I was medically free before this 2 to 3 days back.
Yes. Okay, so I will ask you, any raising in body temperature?
I feel myself hot, yes, about,
Oh,
and I check one time it was 37.5, point
oh,
6 like this.
okay. And these happen all with the recent tiredness, all right?
Yes, all started with each other, and it
Okay,
is worsening. Everything is worsening with time.
okay. Any sweating?
Everything goes a fever. No
Yes, any
sweating,
sweating?
doctor.
Okay. Any lumps or bumps anywhere in your body?
Yes, doctor. I feel lumps in my above my bone and in army bed and also in private area. I feel this
Mm, okay. And
glands
since
and
when
it is
you have this?
painful.
Mm,
So
and since when you
all started 3 days.
all the
All
same,
started
right?
3 days.
Okay.
Yes.
Okay. Right. And any weight changes?
Any what?
Weight changes.
Wait.
Yes, any changing in your weight?
Only 3 days, doctor. But since this time, I have no desire for eating at all.
Yeah, right. So, okay. So, do you have anyone? What about your appetite? So it's not that good
Yes,
recent,
I feel throwing up and
right? Okay.
feeling sick all the time. How I will eat like this? No way.
Yeah. And how you maintain your taking of food recently?
I'm not taking food, only some fluid and some
Right.
sugar juice
Okay.
to
Okay, I
up.
can understand that. Okay, so anyone commenting that are you looking paler than usual?
No.
Any runny nose, flu-like illness recently or previously?
Yes, it is. I'm thinking it is flu-like symptoms. I feel
Mm,
that I get influenza infection
no,
or common
mm,
cold like this.
I can understand that. So any mouth
But
sore?
ye- yes, I have mouth sores and it is painful, also, doctor. Yes.
Okay, and since when? This happened recently within these 2 days, right?
What?
And when you notice this mouth sore?
In the inner side of the lower lip and
Right.
also in the covering layer of the my buccal mucosa.
Okay. Right. So okay. Any cough recently,
Yes, I feel cough, yes,
and is
but
it
not
dry
so
cough?
much.
Okay. Any association with
Right.
the phlegm or is dry?
No, no, no. It is only dry, and it is not a big issue for me.
Okay.
Cough,
Any
yes.
diffi okay. Any difficulty in breathing?
No, no, no,
Okay. Any chest pain when sitting, standing, or leaning forward?
no,
All right.
no, no,
Any,
no.
right. Okay, so you have sore in your mouth. Sorry to ask you, but any soreness in your private area?
Yes, yes, and it is also painful, like my mouth sore also.
Right. Okay, so I will ask you just, do you have any disease run in your family similar to your condition? Like they have this soreness in their mouth or private area?
No, no,
Right. Any disease run in your family?
no.
Right. Okay. So do you have any changing in your bowel habits?
Yes, I have loose motion also, doctor, and it is watery.
Right. Okay.
Yes,
And
two to
since
three
when you
days.
have it? 2 to 3 days,
Yes,
right? And
yes.
how many times per day you pass motion?
About first day it was 2 times, but
Mm,
it was worked with time. Today about 4 to 5 times,
okay.
really.
Any association with the blood, or is it watery?
No, no, no.
Right.
Watery, yes, watery.
Okay. So any changing in your water work amount, frequency?
Yes, amount is decreasing because no food.
Right. Any frothy urine?
No, 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 no
Any
frozen.
puffiness around your eye?
No, no, no,
Any dryness, feeling that you have dryness in your mouth?
no, no.
Dizziness when you change your position from sitting to standing?
Yes, I feel dizzy, but I think this because I am
Right.
not eating, drinking well. I
Okay.
feel dizzy.
So, okay. So I will ask you, sorry to ask you, but in your case, it's very important. So if you don't mind, do you travel recently to any area?
No, no, doctor, I did
Uh,
not.
do you use any illicit drug through our needle?
Yes,
Any,
doctor. About 5 weeks back, we did a very big party, and we invite all our friends and girls, and we celebrating all the night, and at that time we take
Mhm.
some.
Right. And are you married?
Yes, I'm married, doctor.
And in any extramarital relationship?
No, 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 no,
Right. Okay. So do you drink alcohol?
no, no. يعني at the weekend like this only.
Right. Okay. So do you smoke?
No,
Okay. Regarding the alcohol, are you binging drinking sometimes? Because you mentioned previously that you have been attending a party. Any binging drinking of alcohol?
any what?
Binging of drinking alcohol, not drinking the
What
not,
is binging? What
not
is binging?
drinking the recommended amount
Heavy,
sometimes.
A lot
heavy,
of
heavy drinker. Yeah,
a
heavy
lot.
drink.
No, 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 no. Yes, at that time of this party, yes, it was very an unexpected day, really. We do
Right.
everything, but
Right.
otherwise, I'm not drinking alcohol so much. Only at
Do
the
you have
weekend, like this.
okay? Right, I can understand that. Right. And do you have any weakness anywhere in your body?
All my body is weak, doctor.
Okay. Any abnormal movement or fits?
No,
Do you have any problem with your eyes? Any sore eyes or painful eye?
no.
Any pain when you just put your head on your chest? Do you feel any stiffness?
Yes, sometimes I feel my neck is not freely mobile. Yes, this,
Right.
I think
Okay.
this is because of him.
Right. Okay. Can understand that. And this headache it happened all recently, right? Okay.
Yes,
Oh,
this within 3 days.
okay.
Yes.
I can understand that. Okay. So, Mr. George, I would like now to examine you if you don't mind. I will
Yes,
start
exam.
by taking the general look of the patient. Is he a cajexic or not? The body mass index, right? And then
He's not kashik, but he looks toxic. He looks toxic.
right. Okay. So, and then I will start by his hand, looking for any needle mark.
In the hand, yes, in the hand there is macules and papules rash in his palms.
Mm, okay. And then I would look to his pulse. Is it tachycardia or not?
Yes, tachycardic, yes,
Right.
regular,
Is it
equal,
regular?
both.
Okay. And then I
Yes,
will go looking to his blood pressure, asking to measure the blood pressure sitting and standing. And then I
pressure
will
is
look for,
90 by 60. Yes, blood pressure.
right. And then I will check for proximal myopathy.
Yes, present.
Okay. And then I will go to his eye, look for any jaundice, for any pallor or redness by torch.
Oh,
I will offer fundoscopy for papilledema.
no need.
Right. And then I will open his mouth, looking for any cyanosis and look for this painful sore.
Yes, there is ulcers in the buccal mucosa and in the lower lip. Inner
Right.
side.
And I will look, and I will look for his any rash in his face and ask him any rash that is changing with exposure to the sun.
There is, there is
Right.
rash on the trunk, macules and papules also, but no photosensitive rash in the face.
Right. Okay. Then I will macules and papules. Right. All right. And then I will go to his neck looking for any lymphadenopathy.
Yes, there is swollen lymph cervical and axillary, and it is painful and swollen. Yes,
Right. Okay. Then I will go to his heart checking for any murmur.
no murmurs.
Okay. And then auscultate his chest for any crepitation. Is it
Chest
good
is
air
clear.
entry? Right.
Chest.
And then I will go to his abdomen for organomegaly or
2 minutes left.
any
There
organomegaly.
there is tenderness in the right hypochondrial area, but there is no organomegaly.
Okay. Tenderness and no underlying mass or scar.
No.
Then I will check his leg for any leg edema, pitting edema.
There is no edema, but in the soles there is also macules and papules. In the soles of the legs.
Okay. I would like to do the Brodnitsky and Kernan signs suggesting of any meningitis. checking the neck stiffness,
No,
Kerning.
it is normal Babinski. It is going down.
Okay. And then I will just check single sensation, maybe proprioception and fine touch.
Yeah. Yes, sensation. He has hyperesthesia in the legs. Sensation.
Right. So now, Mr. George, can I ask you what's your concern?
What is going on, doctor? I am medically free before. Why,
Right.
why this is influenza? It is severe. It is COVID, doctor.
Yes, I can understand your concern after I taking history from you and examine you. Most likely, you have some infection that happened recently that affecting you in this way, leading to the symptoms that you have of tiredness and this generalized muscle pain and sore throat, as you mentioned. So why you ask about COVID exactly? Anything in your mind now?
Because COVID is going on nowadays.
Right.
I'm worried about it. Yes.
Right, I can understand that. So before I want to tell you that maybe the risky behavior that you have been lately of using those needles with illicit drug maybe contribute to lowering the defensive system that you have expose you to many infection. COVID could be one of the possibilities, or could be other source of infection. We need to exclude it. So what we need
Okay,
to do is
doctor.
to admit you, run for you some blood tests and imaging, and then we will sit with you further to discuss the plan of management. Is that okay with you?
Okay, doctor. Thank you. Thank you, doctor.
Okay, time is up. Examine the question. It was
Doctor,
not.
what is the differential diagnosis for this infection?
Yes, my top differential diagnosis could be with his age, 38 years, with risky behavior, could be HIV
Why not
infection.
tell him that this is HIV? Why you not tell him this is possibly HIV infection? Okay, second differential.
I need to do some blood tests and make sure first to say it's exactly an
Okay.
HIV, but it's the top of differential diagnosis. Other differential could be even connective tissue disease, but unlikely with his recent illness that he have within 2 days. Could be other source of infection, simple
Like,
infection, such as influenza,
yes,
leading to the symptoms that you have.
yes.
Or could
What?
be, yes, could be even meningitis. So, yeah, meningitis with the associated tiredness, fatigue, muscle pain, with
Meningitis
urine,
with which? Yes, meningitis with which organism?
um, mainly, I don't have, maybe pneumococcus meningitis.
What else?
Um, this is what I have actually in my mind.
Okay, after you admit this patient, what you will do after you admit?
Yes, first I will do for him blood test.
What
Um,
is the blood test?
yes,
You will start normal saline first, IV fluids also, and supportive.
yes,
Then
I will,
you take samples, or because blood
yes,
pressure is low.
yes, admit him for IV fluids and maybe supportive
Yes. Then
treatment.
what is the yes? What is the blood test you wanted to do to analyze this infection or narrow the differential diagnosis?
Yes, I will send for complete blood count, renal function test, liver function test, inflammatory markers. I would
Yes.
run investigation to explore more the cause of his recent illness. I would do blood culture, urine analysis and culture, even stool culture, and mm, um, because he have mentioned that he have recent diarrheal illness.
Gramstin, blood culture for mean Gramstin culture, aerobic and anaerobic, like this.
Yes, general,
Bacterial يعني infection.
general, general, yes, blood culture and
Yes.
activity.
Yes.
And
What else? What else?
Yes, I could run.
You said this differential for you is HIV. So how you will investigate this HIV?
Yes, HIV screening by doing an HIV test.
What is the test? What is the name of this test?
Mm, yes, that does not come in my mind. Um,
Oh, okay, okay. Okay, doctor. So this after investigations and you confirmed that this is HIV. So what you will do?
involve a team of doctor, infectious doctor, and occupational health doctor, even a social worker if needed, specialized staff nurse, um, mm, um, and then start pharmacological treatment by starting antiviral therapy.
Yes. What is the name of this antiviral? What is the name of this antiviral?
It doesn't come in my mind actually. HIV treatment now.
Okay. Okay, doctor. Name heart. Heart. You remember? Heart.
Mm-hmm.
You also don't know the abbreviation for this medication. But this is the role of the doctors. Okay, now I finish now. If Dr. Basim wanted to ask questions, okay.
Why you want to admit this patient?
He mentioned that he have hypotensive
Mhm.
and to investigate more for about HIV,
Any screening you want to do?
to notify the disease, and yes, to do
Any family
screening
screening?
for HIV.
Yeah.
Um, mm,
Why not? Okay, what's your team? What team you will involve in this patient? Multidisciplinary team, including what?
yes, it's mainly involvement of infectious doctor, infection department, notify the disease, acknowledge the patient of for a need for HIV testing and maybe family screening.
Okay, fair enough. Thank you for that. Well done. You can hear the comment from Dr. Mahmoud, then I will comment.
Yes, this the name of this issue is seroconversion for the HIV, or it named as primary HIV infection. It has either the name of this uh, attack is acute HIV infection, primary HIV infection, or seroconversion of the HIV. This is the stages of HIV exposure, first exposure, then 2 to 6 weeks prodrome, then this attack, which we are talking about. This primary HIV infection. It look like infectious mononucleosis or influenza infection, upper respiratory infection. But the difference between them, this HIV is severe and persistent, not only 2 to 3 days, but it lasts for 1 to 3 weeks. This attack. This is a painful mouth ulcer, painful ulcers in the genital area, swollen lymph nodes, cervical, axillary, and inguinal. Um, Also, there is maybe enlarged liver and tender. The most characteristic is maculopapular rash, present on all over the body. Any area of the body is not immune for that, including the palms and soul, which is more pathognomonic for it. Fever is present in about 80% of the cases, and it is يعني 38, 39 like this. This is what I know from this. Also from the GIT infection, GIT clinical signs, nausea, vomiting, diarrhea, sometimes weight loss also maybe. From the immunological side, there is headache, look like aseptic meningitis. There is peripheral neuropathy. There is myalgia and arthralgia, muscle pain and joint pain. This is what I know from the seroconversion of the HIV. Diagnosis, yes, this patient at that time is highly infectious, so he should be admitted and isolated. There is name as third generation investigation. This cannot detect the organism or the antibodies in the first few weeks after infection, but the third generation, it is more sensitive to the antibody ELISA test and the PCR. PCR for the RNA virus, it's also qualitative and quantitative, and it is good sensitive for it. PCR. It name reverse transcriptase PCR. This is the attack of seroconversion. It lasts for 1 to 3 weeks. Then it subsided, and the patient stayed for asymptomatic for 2 to 10 years. Then it's developed. So it is prodrome exposure, 2 to 6 weeks prodrome, then acute seroconversion state. It lasts for 1 to 3 weeks, then become improve and become asymptomatic for 2 years to 10 years. Then become AIDS. At that time of AIDS, there is opportunistic infection, dementia, HIV encephalopathy, and what is named as HIV wasting syndrome. So this is what I know from about HIV.
Perfect, Dr. Mahdi. Very common and good preparation and performance and explanation of the disease. And for Dr. Huda, she did well. She reached a diagnosis, however, she didn't mention to the patient. He concerned about something, but you have to put in your mind the most serious. If you compare COVID to the HIV seriousness, which will be more serious, Dr. Huda?
أكيد أكثر.
HIV. Always put in your mind some serious differential which can be explained to the patient, even if he concerned about something less serious. We are always thinking about the most serious. Of course, if we have some alarming signs. So for example, if the patient is suspected to be irritable bowel syndrome, you will not say it could be cancer. No, unless you have some alarming sign, you will mention the most serious. In this patient history and examination, he has a lot of alarming signs and symptoms in the history and in the examination. In the history, you got a very risky habit, and it was a very good question. You asked target question. Any sharing needles? Yeah, he said yes, doctor. And it was enough time to be acquired the infection from the needle, which is 1 month or within 1 month. So most probably this is a case of HIV. You have to explain to him, even he's concerned about COVID. Yes, it could be one of the possibility. However, you don't have chest symptoms, but we are suspecting something maybe serious. What doctor? What I have? Is it cancer? I appreciate your worry. No, it's not a cancer. Actually, we are suspecting HIV. Have you ever heard about HIV? Yes, doctor, I heard about and blah blah blah. Then either to tell him we're gonna screen it, or we will do some blood test to confirm it. However, you need to be admitted in the hospital. Okay. He has also dizziness from standing from sitting position. This is another sign of dehydration. The infectious area here also should be put in your mind. We should isolate him. He has a lot of HIV virus load. By the way, he might be having high load of virus. If you do the quantitative, the viral load will be high. Okay. So this is the way how to convince and how to explain the disease for the patient. In the history taking, you went in systematic and organized way, but you missed the family history. Why I ask you in the examiner question about screening of the family? You should ask. He might have spreading this cancer, this infection to his wife. Okay, he doesn't have any casual relationships, but he has his wife, and he might also spread the infection to his wife. If you ask him about any symptoms or similar symptoms in the family, and if he told you, yes, my wife had some of these symptoms, what do you think? For the welfare, you might screen his wife, right?
No.
So it's important. Always remember the three categories of social. I mean, family history, travel history. Perfect, you ask about travel history. Always bring them together. Family history, travel history, and HIV history, which is, as you mentioned, sharing needles, tattooing, piercing, blood transfusion, or recreational drugs. Earlier, you will ask about past medical history, which you already excluded earlier, which is good, organized way. The history taking today much better.
لا لا
It,
لا ما قلت لك
it,
اللي
it
عندي.
went smooth. Sorry, someone. Okay, it went smooth and you catch possibly the disease. I thought you catch it when you ask about the sharing needs, and he told you, yes, doctor, I have. And by the way, the rash, if you want to roll out something else, as some doctors wrote, bilonargica for reactive arthritis, keratoderma bilonargica, which is characteristic lesions for reactive. It comes in the soles and in the palm. Whenever you feel this is related to them, you have to ask about any urinary tract infection. I guess you ask about any change of your water work, but you can specify a question for discharge coming from a private area and so on. But again, the HIV as top differential, you put it, but you have to explain it to the patient. It's the matter of concern and examiner questions. Don't to do discrepancy between both. I mean, don't say here something and to the examiner another. If you want mention the HIV to the patient, mention to the examiner and the same. If you mention to the examiner, mention to the patient because he will say why you didn't tell him the patient, as Dr. Muhi asked you, why you didn't tell him about HIV. He concerned about COVID, yes, but the most serious now HIV and the uh, most I mean the diagnosis reach and more make sense in this scenario is HIV. And you have to know, as Dr. Mahi said, HIV seroconversion syndrome, which happens almost 1 month after getting or acquiring the virus. Then it will regress, and the patient will have like a quiet period of infection. Then he will have again the opportunistic infection, either chest or abdomen or lymphoma or whatsoever. This is the way how the HIV acquired in the body. Okay, Dr. Huda, clear?
Okay, clear, doctor. Thank you.
Any question from you? You have to know the opportunistic infection for HIV. It comes as separate cases, like BCB pneumonia. It comes, a patient came with atypical pneumonia, dry cough, and hypoxia with the background of HIV. This is one of the presentation. The other presentation will be diarrhea. So either cryptococcal or HIV wasting diarrhea or lymphoma. It might present like this. Sometimes it comes as meningitis, so the patient will have meningitis on background of HIV. Also, it might be encephalopathy, again HIV or lymphoma, or the other zoonotic infection, what's called HIV, cryptococcal, and lymphoma. And there is one more. Someone can remind us. Fungal
You
infection.
mean infection mononucleosis or what?
No, in the brain. Infection mononucleosis will be splenomegaly with lymphadenopathy.
Toxoplasmosis.
Yeah, toxoplasmosis. Yes, this is the one. Yeah, toxoplasmosis is one of the opportunistic infection also. And if the patient is diagnosed HIV, we have to do CD20 count, and also to check for his viral load, and accordingly he will receive highly activated antiretroviral therapy, heart. No need to know all of them. Sorry, CD4 count. I said CD20, CD4 count. And if less than 200, he should receive prophylactic, as we discussed and we studied in part 2. They are not asking in details, but at least tell him we gonna start him on HAART, HAART. Okay, this is a specific antiviral, but he will not mention about names because most of the examiner will not know about the names. But at least to know how to investigate, how to screen, how to notify, as Dr. Mahi said, but it's not notifiable disease. You have to screen without notification. It's not notifiable disease anymore, but you have to screen his family. Okay, this is a tricky point. HIV in UK it's not notifiable disease anymore. TB is notifiable, but the HIV is not. Let's open discussion. Anyone want to add something I miss? Anyone want
If
to ask about? Yes.
Assalamu alaikum.
Alaikum
If he
assalam.
tells
Yes.
that he is married,
Yeah.
and so I will tell
Yes.
the point, he will tell his wife or not. This point
Yeah.
should be
This is
raised
another
or not.
point, but it will be in communication scenario, not in
Yes,
this
yes,
scenario.
communications. That is why I'm asking.
Yeah. Yeah. So if he said no, don't tell. You encourage him to tell his wife, and you give and reassure him about the privacy, and she is the one supporting you. She need also to be screened for your kids' safety and blah blah blah. Try to convince him to encourage. If he refuses, we can do the next step, which is called co-meeting. So we will arrange a meeting with you and our doctors to deliver this message without hurting her feelings. So by our team, it's our job. No worries, we will arrange a meeting and we will be the one delivering this message. If he refuse totally, we can do what's called anonymous notification. So we'll send message to his wife that someone got infection or contact with you and he is having HIV. We want to screen you. And at the end, we are sorry to inform and we are bounded to inform your
We
wife
will
because,
break his confidentiality. We
yeah,
have
at the
right,
end,
yeah.
yes, at the end, if he refused
Okay.
totally.
If he's not convinced to tell her.
Yes,
Okay,
yes.
shukran.
Most welcome, doctor. Yeah, Dr. Tagwa wrote progressive multifocal leukoencephalopathy. This is, I guess, this is JC virus, right? JC virus on top of HIV. Any question else? I don't want to be
Assalamu
one
alaikum.
one way. Yeah, go ahead, Dr. Rashid. Walaikum assalam. How are you?
This 2 days history is very short for all these things to develop abruptly like that. Very short. Quiz. Then the ulcer of the soles and mouse. Is this characteristic for HIV like this?
Yes.
Like keratoderma, what we call it, psoriasis, and
Skin rash,
active arthritis, what I
it's
know.
not only in the palm and sole, everywhere. The rash of HIV seroconversion, everywhere in the body.
The mouse sore also, mouse ulcer.
Yes, it will be
What I
like
know it
this.
is
What? It's
it is
for
flu-like
the
illness for sore throat like that. But specifically ulcers and buccal mucosa ulcer, the opsis ulcer, I don't know. This is it characteristic for HIV seroconversion?
the seroconversion means the antibodies attacking the virus everywhere, and it was a very high load of the virus. That's why patients present with everything: sore throat, diarrhea, skin rash,
Yeah, sore throat, yes,
lymph
but
node.
ulcer, I mean, mouse
I
ulcer.
think also there is mouth. I don't know if you are if you have some evidence, you can share it, but it could be present with this skin rash and mouth sores.
I didn't hear about ulcer, لكن it's sore throat and flu, like
Okay, we can
seizure, yes.
confirm it. We can confirm it.
Yes, Dr. Rashid, it is characteristic for this infection, for HIV
Ulcer?
seroconversion. Yes, ulcers and lymphadenopathy, fever, and all these things.
Yeah.
Sore throat and all. I shared one paper.
Thank you, Dr. Maha.
Welcome, Doctor.
Okay. Thank you, Dr. Rashid, as well. Always this debate make the point more clear for us and for others. If you have some doubts, please raise it. We can clarify by another and second opinion, not mine only. Okay, this is not a meeting for one-way discussion. We can discuss together to make the things clear. I guess the case clear now for everyone. By the way, if you want to screen this patient in the early stage, you might do the P24 antigen. But if the patient already manifested with this presentation, means that the antibodies already formed. So you can check for the antibodies. Okay?
Yes, you're right, Dr. Bassem.
Yeah. So if the patient have needle stick, for example, and you are worried and nothing appear on the patient, you can do the P24 antigen after 2 weeks. But if the patient already presented with symptoms and signs, means the antibodies already formed, and you can check it by PCR and ELISA. Okay, clear HIV for all. It's very high topic in the exam. And by the way, if you have something related to constitutional symptoms, you have to put HIV along with cancer as a differential. So if this patient concerned about cancer, what do you think, Dr. Huda? Can you tell me if he asks you, doctor, do I have a cancer? How you can answer him?
Yes, cancer, one of the
Perfect.
possibilities we
Yeah.
need to.
What cancer you can think about in this page?
In case of HIV, there is maybe lymphoma.
Yeah, this is enough. So patient with multiple lymphadenopathy, lymphoma is on top of my differential. And always lymphoma is differential for HIV and HIV is differential to lymphoma. Because all constitutional symptoms will be positive. Loss of weight, loss of appetite, high body temperature, night sweats, lumps or bumps. Okay? Any
Yes,
comment or
Dr. Ba-
questions?
I have a question that multiple differentials were coming in our mind. It's like in this scenario, if examiner asks or if patient asks, can we give our differentials like this? That I'm suspecting some infections and some malignancy causes in infections like Epstein-Barr virus, cytomegalovirus, HIV, in malignancy like lymphoma. So can we present like this?
Yeah. Any generalized lymphadenopathy, you can put lymphoma and HIV. You can say TB, lymphadenitis, cytomegalovirus, and even infectious mononucleosis. These are the common cause of generalized lymphadenopathy.
Yes.
Okay,
So if we
TB
don't,
also you can.
yeah, so yani, if we don't give only one name, HIV, and we give differential, so it's okay, yani.
No, it's okay to say them after HIV. HIV in the top.
Yes, yes. We will say in differentials of
Yeah,
infection like
yes,
cytomegalovirus, Epstein-Barr virus, HIV, and other differentials like lymphoma.
perfect. But HIV, the most concerned viral infection in this scenario.
Yeah. Yes. Thank you.
Most
Dr.
well.
Bassem, I did not attend the whole session. What was the risk factor for this patient?
He had a party and they are celebrating together and they share needles with the recreational drugs.
Okay, okay. Thank you so much.
No problem. Next one. Okay, Dr. Huda, can you post the scenario for Dr. Muhi?
Okay.
Sore throat, lymphadenopathy, malaise, arthralgia. If you want to narrow your differential, Dr. Huda, when you start the analysis, if you are worried about the other complaint, focus on the tiredness or fatigue and go with the algorithm of fatigue with weight loss or fatigue with weight gain. If you have fatigue with weight loss, so you'll think about infection, cancer, serious infection, occurrence, or autoimmune or connective tissue disease. If you have fatigue with weight gain, you will think about endocrinology causes like hypothyroidism, like Cushing, like acromegaly, like polycystic ovarian syndrome. Okay, in this way you will be
Point A, obstructive sleep apnea also.
what? Sorry?
Obstructive sleep apnea.
Yeah, obstructive apnea can cause weight gain with fatigue. So you can narrow your thinking. If you have fatigue, this is advice, please. If you have fatigue in any presentation, along with other complaint, start to analyze the fatigue first. If you catch the weight gain or the weight loss associated with fatigue, you can know what's your case about. Either weight loss, it will be serious infection or cancer, or weight gain, it will be endocrinology cause. After that, you can analyze the other complaint. Dr. Mahi, here's scenario. Mrs. Julia Adam, 60 years old, present with back pain. Okay, Mrs. Julia Adam. Try to confirm the patient name by two names, not only one. So whenever you go to this patient for the introduction, I am Dr. X, one of the doctors here. Can I confirm you are Mrs. Julia Adam? You are 60 years old. Okay, don't say Julia only and don't say the age only. Double name and the age. Okay, let's go to the comment and Dr. Muhi will be ready. Exclude staphylococcus. Of course, we have to exclude infective endocarditis, and he excluded by two questions in the examination. What are the questions to rule out infective endocarditis in this patient? Who knows how to rule out infective endocarditis in this patient? Any volunteer? Again, I prefer to be discussion with others, not only me to talk. Anyone has idea how to exclude infective endocarditis in this patient? It's very important and easy question and easy answer.
First, the short period, only 3
No,
days.
not from history, from examination.
Examination murmurs.
Okay, this is cardiac
Murmurs.
examination. What other signs for infective endocarditis?
Peripheral stigmata, Genway
Yes,
lesion, and
yes,
ocular
perfect.
nodes,
That's it. Vascular or yeah, autoimmune and
glomerulonephritis.
rotor spots. Perfect. Yes, yes, exactly. So you will find, and you have to, Doctor. By the way, Doctor Huda, you have to ask about signs and symptoms. Sorry, the signs of infective endocarditis in this patient. So hold his hand, as you said. I will check for any chain, the rash, and blah blah blah. But you have to specify the Janeway lesions, splinter hemorrhage, osseous nodes. Turn the hand for clubbing. You have to specify. He will tell you why, because this is HIV, and once patient is having HIV, he might have infected endocarditis. Okay, because he's immunocompromised and he shared needles, so you have also another trigger for the infection through the blood. Okay, injection mark you have to mention, especially in the groin area and cubital area. Don't forget these things. Rough spot, of course, you can offer fundoscopy looking for rough spot in the eye, in the retina. It's immunological reaction. You can offer also bedside test for hematuria as immunological reaction in the kidney. And of course, the cardiac examination will be full cardiac examination from the apex, the murmur, and the signs of pulmonary hypertension. Okay, ready, Dr. Mahi?
Yes, yes.
I don't know, all people today quiet. Okay, let's start the second scenario, and we will refresh them in the next scenario. Here you go, Dr. Mahi. You can start, Dr. Mahdi and Dr. Hadi.
Hello, good morning. Hello, good morning. I'm Dr. Ismail, as a senior health officer with the clinic today. Am I talking to Miss Julia Adam, and you are 60 years of age?
Yes, doctor.
Nice to meet you, Miss Julia.
Okay, doctor.
Today we will discuss your health condition, and I will examine you and address your concern. Is that okay with you?
Yes, okay.
How I can help you today, Miss Julia?
Yes, I came because I have back pain and want to know the reason for it.
I'm sorry for that. For how long you have this back pain?
For 1 month.
Well, this is the first time for you to have this back pain?
Yes, this is the first time.
Do you feel it is the same or increasing or decreasing?
Yes, it's increasing.
Increasing. It is increasing. This pain, what aggravate it? Moving, or you are better when you are at rest?
Yes, mainly when I move or lift something. Yes,
It pain become increase.
yes.
Otherwise, you are okay without pain. If you are sleeping or at bed or a chair, no pain, or
No, sometimes I feel this dull pain all over my back, but it's mainly increasing when I move mainly, yes.
Okay. Do you have any stiffness with this pain?
No, doctor.
No stiffness. Okay. Do you have any other joint have any similar problem?
No, doctor.
Only back pain?
Yes, mainly back pain.
Okay, I'm sorry for that. Okay, I'm sorry. Miss Julia, may I ask you, do you have any other symptom like any change in your weight?
Yes, I have changing in my weight.
What, increase or decrease?
I lost, yeah, it's decreased. I lost 3 kg of my weight in the last 3 months.
I'm sorry for that. And it is unintentional.
Yes, I didn't try to lose it.
What about your appetite?
It's fine, doctor. No problem.
Mhm. Okay. Do you feel any raise of your body temperature, mainly at night?
And not mainly at night, but yes, I have this reading in my body temperature, but I didn't check it.
Any sweating?
No sweating.
Do you feel any lumps or bumps in your body?
No, doctor.
Any change in your water work?
What do you mean, doctor?
Uh, your urine, they decreasing in amount or the same or increasing?
I think it's the same, doctor.
Okay. Do you feel your urine become frothy?
Yes, doctor.
Any blood mixed with this urine?
No.
Okay. What about your bowel habit? Any change in your bowel habit?
Yes, I've been feeling more passing of a hard stool. Yes.
Okay. Any difficulty swallowing?
No, doctor.
Any feeling sick?
Yes.
For how long?
With this 1 month.
I'm sorry for that. But you can cope with this. You feeding is no problem and drinking water no problem.
Yes, I try, doctor. It's fine.
Any throwing up?
No throwing up, no.
Okay. Okay. Do you have any skin rash?
No skin rash.
Any joint pain other than the back pain?
No, doctor.
Sorry to ask you, Ms. Julia, do you have any past medical history I should be aware of?
No, doctor.
Any rise in your body blood sugar or blood pressure?
No, but I admitted maybe 1 week ago to the hospital because I told you that I have a hard stool, but I had this loose motion about 2 weeks ago and admitted to the hospital. I get some IV fluid and yes, That's my only admission.
Hmm. Okay. Do you have any medication list?
No, doctor.
Hmm. Do you have any over-the-counter medication?
Okay, I maybe sometimes take some pain relieving medication such as baclofen for this back pain. But other than this, no.
Hmm. Sorry to ask you this question. I ask you this question usually to my patients to reach to the diagnosis. Do you have any illicit drugs or recreational drugs?
No, doctor.
Okay, okay. I'm sorry to ask you, do you have any family history of cancer?
No, doctor.
Any family history of note?
No, doctor.
Any family history of sudden cardiac death?
No.
Okay, okay. Uh, what is your job, Mrs. Julia?
I'm retired, doctor.
Okay, what was your job before?
I was employee.
Hmm. Okay, okay. Do you smoke?
No.
Do you drink alcohol?
No, doctor.
With whom you are living, Mrs. Julia?
Yes, with my son and my husband.
Okay, okay, Miss Julia. I wanted to ask you some rapid questions with answer yes or no. Do you have any headache?
Sometimes, but not all the time, doctor.
Mhm. Okay. Do you have any abnormal sensation
No, doctor.
in your limb? Okay. What about control of your water work and control of your
It's fine, doctor.
bowel habit? It is okay? Okay. It's before?
My bowel habits, it's okay. But I told you most of the time I have a hard stool. But before 2 weeks, I have this loose motion. Other than that, I have a good control.
Okay. I ask you about fits. Any fits before?
No, doctor.
Shaking of your body?
No, doctor.
Any loss of your conscious level before?
No.
Any race of your heartbeat?
Yes, sometimes, doctor.
When?
With this last 1 month till now,
Hmm. Yes. What exaggerates this heart racing?
activities, sometimes even at rest.
But it is regular?
Yes, regular.
Any loss of consciousness during
No, you
this
asked
race
me,
of your
doctor, but
heartbeat?
no, doctor.
Okay. How many pillows you
Fine, I lie on the bed
use
normally. No pillows.
during sleep? Okay. And no swelling in your legs?
No swelling, no.
Any noisy chest?
No noisy chest, no.
Any cough?
No cough.
Any tummy pain?
Sometimes I have, yes, she point to her epigastric area. I have been in this area. Yes, like a burn sensation. They told me because I have this medication, baclofen. Yes.
Mm. Mm. But you have ever before any dark stool due to
No,
this painkiller?
no, doctor.
Okay. How this pain in your tummy relief by what? Do you relieve it
Um,
by what?
Nothing actually relieve it, but I started to stopping take this baclofen. But it's the same.
Okay, 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 Miss. Sorry to ask you, do you have any skin rash?
No skin rash, no.
Okay, okay, okay. May I examine you, Miss Julia?
Yes, doctor.
I wanted to look to the patient as a general inspection. Is there any characteristic features of cachexia, body
Negative,
weight, temporalis? Okay,
negative.
toxic, looks dehydrated, skin turgor, mouse. Is there
No dehydration.
any discoloration of the eyes? Is there any jaundice, any pallor?
There is pallor, some pallor, no jaundice.
What about proximal myopathy? Is there any proximal myopathy?
Negative.
What about blood pressure? Blood pressure is
Yes, normal blood pressure.
blood pressure normal. Okay, I will check the pulse bilaterally and compare between them. Is there any characteristics?
No, normal pulse or regular.
Okay, I look to the hands for any clubbing, any pallor, any erythema, palmar erythema,
Negative.
any wasting of the muscles of the hand.
Negative.
Okay, I will go to the heart and I will see an auscultation for any, and the lung also for air entry. Is there any problem?
Negative.
I will see the abdomen and I will ask the patient, do you have any pain?
Yes, I have.
Before I examine you.
Yes, pain in the, she pointed the gastric area. Please don't touch it. That's all.
Okay, I will be gentle with you during the examination. If you feel pain, let me know. Excuse me, Miss Julia, okay?
Okay.
I will do superficial palpation, then deep palpation, and while I'm looking to the face of the patient to see any organomegaly, any abnormality, spleen, liver, okay?
Negative, doctor.
I will do ballotment to see the kidneys.
Negative.
Okay. Okay. I will see the lower limbs also for anything. See the pulse, peripheral pulses, dorsalis pedis, and any edema lower limb.
Negative.
Okay. Miss Julia, may I ask you what is your concern?
Yes, I want to know the reason for my back pain.
After I take history from you and I examine you, Miss Julia, I'm sorry to tell you that I'm thinking about a medical condition named as multiple myeloma. It is a type of cancer affecting your blood, and it is manifested by increase in your calcium in the blood. This causing this hard motion and the gastric pain. And I wanted to check your blood pressure also. Another site, maybe it is elevated. And sorry, Miss Julia, you told me your urine amount is normal, not increased or decreased?
I told you mainly it's a frothy, doctor.
Only frothy, okay. Right now, Miss Julia, I will admit you and I will run you for you some investigations. Sorry, Miss Julia, may I examine your back? Excuse
Yes.
me, can you expose your back to me?
Yes. What
I
you
will
can.
I
2
will
minutes left.
examine to the paravertebral muscles and I will touch this area. Do you have pain at that time? I will be gentle with you, Miss Julia. Then I will press to see if there is any tenderness. Is there any tenderness in the back?
Yes, doctor. In my lower back, I have tenderness.
Okay. If you been leaning forward, is this pain increase, Miss Julia?
Yes, sure, doctor.
Okay, Miss Julia. Another possibility, Miss Julia, maybe this is due to osteoporotic fracture with your age and the postmenopausal area time. So I'm not 100% sure for this diagnosis is cancer, but I will admit you and I will run you for you some investigations. I'll do for you something as name as investigation as name DEXA scan also and X-ray for any osteoporotic fracture for that. Okay, okay.
Okay, thank you, doctor.
Welcome, welcome.
Still 1 more minute that you want to ask.
No,
I will examine the lower limb for tone and power and Babinski also because she has back pain. If there is any changes in the weakness, if there is any weakness or abnormal sensation in your legs?
no, doctor.
Okay, okay.
Any scale you want to ask about? Back pain?
What Dr. Basim said?
The scale of the pain, you ask? The scale of
Pain
the
of
pain.
scale,
Score.
score.
Uh, uh,
Yes. How much, Miss Julia, you score this pain from 0 to 10?
It's 6, doctor, out of 10.
Okay. So I will offer painkiller for you right now, okay?
okay,
Yes, fine.
time is up. Well done, Dr. Mahi. Let's start the question, Dr. Huda. You can start now.
Yes, the differential diagnosis.
Differential
Dr. Mahi.
diagnosis. First, I will put differential protect fracture because according to the age and this, so most menopausal, so possibly osteoporotic fracture is one of them. Third differential diagnosis, this is osteomalacia with low vitamin D and sun exposure, and that, but I did not ask about this. So this is mechanical pain mostly. Another thing maybe this is spinal canal stenosis, and this is for diagnosis. Spinal canal stenosis and MITS, but against this MITS, there is no any primary cancer in the lung, or by systemic review, there is no any evidence of primary cancer. Okay.
Okay, so what the investigation you will send for the patient?
I will do general investigations, a specific investigation, and the bedside test. I will do X-ray for hair first to exclude any osteoporotic fracture. And if it is not diagnostic, maybe MRI, it is the next step. I will do DEXA scan also to see maybe this is osteoporosis. Specific investigations, I will do kidney panel test, urea creatinine, serum albumin, protein electrophoresis also, and the urine. I will see how much urine, blood in protein in urine, like this.
Okay. So you say that one of the differential is multiple myeloma. The investigation to mainly to diagnose multiple myeloma, specific to multiple myeloma, what you will send?
Yes, I cannot remember this.
Mhm.
There, protein electrophoresis, it is specific for multiple
Yes.
myeloma. IgA,
Okay.
it will be raised. Is that right?
Yes, protein electrophoresis for urine Benz-Jones protein and bone marrow as well.
Benz-Jones.
Yes.
Benz-Jones, yes, Benz-Jones protein, yes.
Okay. So you say that the second differential could be osteoporosis in this case. What you will do to diagnose specifically osteoporosis?
The specific test is DEXA scan.
Yes,
If it is below minus 2.5, it is diagnostic.
right. Okay, thank you.
Okay.
Okay. What image you want to do, Dr. Mahi?
I will do for multiple myeloma. Is I will do for this back pain X-ray, and I will do generalized X-ray, generalized body X-ray, bone scan, generalized bone scan to see if there is any other sites, including like humerus or vertebrae or long bones of
And
the lower limb.
what
Yeah.
what is the most diagnostic image?
Yes, it is. It is bone scan. It is written like this, bone scan. Maybe
If you do chest X-ray, if you do chest X-ray, it didn't show any abnormality. What more advanced image you want to do?
كانوا بيقولوا عليها مسح الذري، مش كده؟
PET scan, you mean? Okay,
بيت سكان.
What's important team in this scenario? The most
What's
important,
important?
the most important team. You have fracture.
Team.
Yes, you have
Yes.
fracture.
Fracture.
So what team you have to call and to consider?
I think blood hematologist.
If this patient having weakness and neurological symptoms,
Also, yeah,
yes,
uh,
ortho and
yes, is neurosurgeon for
yes, perfect.
and also
Yeah,
ortho we can.
yeah. If you have nerve compression,
Mm.
what's the first
Yes,
medication you think about? Nerve compression.
nerve compression, dexamethasone.
Yes,
Yes,
steroid.
dexamethasone.
Yeah, fair enough. Okay.
Yes.
Thank you, Dr. Mahi. Well done. And I will just say one comment before Dr. Huda start. Once you say to the patient, if you feel discomfort, let me know that you are started to be ready for the exam. This word means you are trying to avoid the injury, or it's important to mention it. So it
What's
comes
it?
with the
I don't understand.
when you say to the patient,
I
I'm
don't understand.
sorry for the pain. If you feel pain, let me know.
Huh.
Means that you are trying to be ready for the exam. I mean, it's something
الامتحان
in
بتاع الشهر
advance.
الجاي. My exam
Yes, but
next month.
most of us forget it, and I really advise them to mention it in the training because we are in the winter season. If you don't say it to the surrogate or the patient and he feel any pain, you'll be in trouble. Not only pain, if even he feel like your hand are cold, it will cut the mark from the welfare. Okay, let's hear Dr. Huda
Yes,
comment.
sir. Sir.
Yes.
While I'm seeing my result, I found they fail me in welfare, and they send it to me in the feedback. Even in the clinical stations, while I'm examining the chest for the patient, it was very simple case, interstitial lung fibrosis, and I saw this daily 5 times. يعني they been in clinical examination, and they sent to me. He did not take permission from the patient to tap on the chest, on the clavicle like this.
Oh my
And he
God.
also decreased me in welfare, and they put me borderline because I, while I'm examining the patient in clinical abdomen or chest, I did not talk to the patient, excuse me, thank you, like this. He said, least communication with the patient,
Where is this center?
like that. This Edinburgh. Very bad, والله. Very bad.
Okay. UK centers. I thought they are
Yes.
fair, but it's
No,
okay.
they are not fair. They are not fair at all.
Forget about it, inshallah. Next time you'll do it. Okay,
إن شاء
Dr.
الله.
لا
Huda.
خير يا دكتور، لا خير إن شاء الله.
Yes, always خير. يلا, Dr. Huda, please, you can start comment.
Yes, this is a 60 years old female presented with signs and symptoms of mechanical back pain. The analysis would be, is there any other sites? Is there any stiffness, any skin rash? Is it increased by movement? She will told you yes. And then you will ask for the severity, more of the nature, the duration, and where is, does it radiate anywhere? The top differential could be osteoporosis. So exclude any possible trauma, any lifting heavy object, and then ask about. She mentioned that she have a loose motion 2 weeks ago. So ask more about this loose motion. Is it related to specific type of food to exclude celiac disease, uh, which precipitate to malabsorption and vitamin D deficiency in calcium lead to osteoporosis. Ask about the drug history, alcohol and smoke. So the other differential could be, as you mentioned, is multiple myeloma. So you ask about, do you pass any water work more than usual, any frothy urine, any puffiness in the eye? Explore more about the signs and symptoms of hypercalcemia, any heartburn, any constipation, anyone commenting that you are looking paler more than usual for multiple myeloma. Explore more about any infection, because ask specifically about TB, any contact with patient with TB, any lumps or bumps, any sweating, any cough. Also, brucellosis could be any contact with cattle, okay, this is the brucellosis. She have a recent admission 2 weeks ago for IV fluid due to diarrheal illness. So could be even staph discitis precipitate to back pain, such as a flu-like illness, any runny nose. Could be the acute or it could be even transverse myelitis. But the top differential would be mainly multiple myeloma and osteoporosis. Regarding the examination, starting from the main complaint, she have a back pain. Then looking for any pallor, any jaundice, explore more, any goiter, any lymphadenopathy. She mentioned she have raising in her heart, so auscultate the chest for any murmur. And any recent infection, so auscultate the chest, ask to do abdominal examination, superficial palpation for this epigastric pain, and even the lower limb for associated amyloidosis or renal involvement due to multiple myeloma. Yes, so here the top differential would be multiple myeloma, osteoporosis, could be infections such as tuberculosis or brucellosis or even staph discitis, could be even a transverse myelitis. So the examination also for lower limb, for the sensory numbness, control over motion and water work, for any incontinence. These are my notes on.
Yes, perfect, Dr. Huda. It's a case of mechanical. You have to know from the start, Dr. Muhi, and I guess you did it. You have to know what the nature of your back pain. Is it inflammatory type or mechanical type? And one question can differentiate whenever you ask, is it worse with the movement or with the wrist? It will be diagnostic for you. So the pain, the mechanical one, will be worse with the movement, and the inflammatory one will worse with the wrist. Or the opposite. You want to ask by the opposite. What can worse it? If she said the wrist worse, so this is inflammatory. All with the mechanical, worse with the movement, because it's called mechanical. So don't confuse yourself. Just ask for the mechanical. Is it worse with the movement? This is mechanical. And the mechanical, of course, will improve with the rest. Anyway, you want to ask or by any question, just try to reach to this is a type of mechanical. And once you reach to the mechanical type, roll out the most common causes of mechanical back pain. I guess Dr. Huda give a lot of differential of mechanical back pain, either brucellosis, TB, and trauma, osteoporosis. All questions for this, you have to roll it out one by one. You confirm already this is mechanical, so you have to roll out all of them. Okay? Try to know the question, the common cause of mechanical back pain in basis, and roll out one by one till you reach the diagnosis. Even if you reach the diagnosis, try to roll out others. If you have inflammatory type pain, you have to roll out also all ankylosing causes, spondylitis. So starting by either seropositive, seronegative, till the reactive one. You have to roll out all of the inflammatory causes. I believe you did great, Dr. Mohi, this time. You were more organized. But supposed to ask about the alarming signs. Did you ask about the weakness, the control over the water work, the bladder, and the gut? It's a very important question. Why?
He asked already.
He asked. Perfect. Okay. This is a cause of admission, an indication of admission. The other indication of admission, the severity of the pain. You have to remember always the onset, course, duration. And if you have pain, please ask about the timing and the position, radiation, and the scale. It's very important to ask about the scale. Why more than 5, as I said earlier, any pain more than 5 in the scale, you might admit this patient. How you can discharge a patient with pain more than 5 out of 10? He will tell you, doctor, I have pain. How you discharge me, right? So this is important question as well. Apart from this, you did great, Dr. Mahi. I don't have comments for the performance and for the examination. Anyone has comment he can share with us, please?
Assalamu alaikum.
Alaikum assalam. Yes, Dr. Rasha.
Yes, regarding this patient, if case to confirm multiple myeloma, what's the symptom? What's the system I want to be examined? Like I want to examine the general and CNS and abdomen and what else?
Remember all the components of multiple myeloma. What are the components of multiple myeloma? On basics. Not in
Yes.
basics. What's called? You remember the abbreviation?
Yes, if the patient, you need to examine the general examination for to rule out anemia. And also need to
Anemia?
examine anemia, yes.
Yeah. Okay, remember first the abbreviation, Dr. Rasha. For part 2, you remember the multiple myeloma, how we can...
Yes,
What's
CARB, hypercalcemia.
CRAB, yes. CRAB.
Uh-huh.
CRAB. So starting by C.
Started by
C,
what?
C, letter C.
Yes, C, yes.
C for what?
Calcium.
You need to...
Calcium, hypercalcemia.
Yes, calcium.
Yes. Yeah. So how you examine for calcium? Abdominal pain, you can examine the abdomen. And if there is other positive finding in the history, you can examine also according to the finding. If there is, for example, renal stone or renal pain, you have to examine for the flanks. And
Yes.
this is for calcium. Okay, the second letter was R. Refer to what?
Renal.
Yeah. So you might have renal, so you will offer for the urine amount, urine dipstick, and also it will be in the history, not in the examination, right? The next letter was for the abbreviation.
P.
Anemia. A.
Anemia.
And the anemia wide finding in the examination, either pallor, jaundice, pallor in the eye, on the pallor in the hands, along with cardiac examination for murmur. And if you have something else related to anemia, like
She
digital rectal
mentioned heart racing.
heart racing, palpitation, pulse volume, all these finding for anemia. Okay. The last was B for bone, right? Bone, crab. The bone means back pain or back pain. You will examine the back.
Yes, you need to do inspection and palpation, and also you need to do CNS examination to rule out any other spinal cord compression.
By the way, here you can offer anal tone examination. Just offer it. You will not do, but just to offer it. Because if the patient has anal tone, you can offer anal tone.
Yes, for what?
Anal tone, because some neurological patient with back pain might lose the tone.
Okay.
The anal tone, right? Especially if he told you, yes. Incontinence, yes, for incontinence. Perfect, yes. Clear?
Okay. Thank you.
Most welcome, Dr. Rasha. Any question else or comment?
Assalamu alaikum. الأونست this he asked about onset, is it acute or gradual؟ لأنه ده بيحدد لنا it will determine for us a differential, is it fracture, it is anterior spine circulation, ischemia, or gradual. You can go over other things for gradual differential.
Yes, you're right, Dr. Rashid. Especially especially the inflammatory types always comes and goes. It will be a clue, right? But for
Yes.
mechanical pain, mostly it will be acute onset, sudden fracture or uh, something compression. But in the inflammatory type, it would be goes and comes and goes or long time duration because it will be associated also with stiffness, other symptoms of inflammatory presentation. You're right. We have to know from the onset. I said any complaint you have to analyze in this way: onset, course, duration, OCD. The least question to ask about are this question: onset, course, duration, and what increase, what decrease, timing, sometimes the radiation, and the scale of pain if you have pain. Thank you, Dr. Rashid. Any other comments, suggestion? So again, second case as differential, we can put a lot of mechanical causes, either multiple myeloma or fracture, osteoporosis, osteomalacia. It could be as mechanical or it would be proximal myopathy one. Who has answer? Can we put osteomalacia in the differential?
Yes, of course.
Yes, I think yes.
Okay, it's related to vitamin D deficiency, but it would be more in the thigh, not in
Yes,
the
on
back.
long bones, long bones.
Yeah, long bone. So it's okay,
And
you can mention it,
generalized.
but it's not as common as the one we mentioned: brucellosis, Pott's disease, osteoporotic fracture, and multiple myeloma. By the way, you can ask also for metastasis or cancer because it could be prostatic cancer with in male you can see prostatic cancer with back metastasis or vertebral metastasis, and in female ovarian or other organs. Okay. What about management, Dr. Mama or Muna? Okay. Management for according to the cause, but for the acute presentation, we have to call for neurosurgery, multidisciplinary team approach, including the neurosurgeon, the orthopedic. Why? Because this patient is sometimes they have neurological symptoms and it might need uh, an urgent intervention. After steroid, we can do decompression surgery. So it's important to offer acute state, we have to offer the team. And for the chronic term, we have to know the cause. According to the cause, we have to treat. If multiple myeloma, so refer to the oncology, hematology, they will do nephrology, according also to their renal involvement, dialysis. If not, other causes, I mean, so you can look for the cause of hypocalcemia or why this patient is having osteoporosis. And don't forget some counseling about avoiding sports or vigorous exercise because for osteoporotic bones, if he left something, he might have another fracture. Vitamin D, calcium is mandatory for all causes of osteoporosis. So a lot of variety of management in this condition. But you have to treat according to the cause. And don't forget the acute management. Okay, clear? Yeah, Dr. Maha wrote magazine, bones, stones, groans, psychic bones, or psychic bones. Yeah, this is for the abbreviation of hypercalcemia manifestation. What system examined? Dr. Rasha, we mentioned already. Long bone, abdominal, what else? Anemia. Yes, anemia you missed. Dr. Rashid, differential either those acute or gradual onset, of course. Well prepared, Dr. Oda, yes, she prepared the case well. Dr. Mahia also, HIV case was very nice. Well done, Dr. Mahia and Dr. Yes, I agree. The thirsty question for hypercalcemia, of course. The mood question, yes. Orthopedic and neurosurgery, yes. Bone scan, PET scan, Bills Jones protein, perfect. Dr. Maha, the red flag, tuna fish. Good abbreviation. Please share it to the group. trauma, unexplained weight loss, neurological symptoms, age more than 50, fever, intravenous drug use, steroid use, history of cancer. I guess also Dr. Hoda mentioned the differential of discitis. It's very important and it comes in the exam. Patient will have IV line or antibiotics for something else, sore throat or infection, pneumonia, and after some time he will have back pain. Blood culture will show some of the organism, which is Staph epidermidis or Staph aureus accordingly, and it could be the case of discitis. Again, it's one of the mechanical back pain. Anyone has comment or question? I think we are done with the session today. Any question or comment? Yeah, Dr. Fazlur Rahman said to you, what do you mean by sudden cardiac death, doctor? Take care of your jargon, Dr. Mahi. You said you have any history of cardiac death. If you want to say, you can say any heart disease running in the family. Okay? Okay. Thank you, everyone. Thank you, Dr. Mahi and Dr. Huda, for the practice today. Thank you, Dr. Abdullah. See you tomorrow, inshallah, the communication day. Good luck and night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr.